I'm Dr. Neely Dean, and I'm an OBGYN. I went to the University of Georgia for my undergraduate studies. I majored in biology and then went to Mercer University School of Medicine to obtain my medical degree. Our practice now offers in-office procedures. We perform LEEPs, Novissures, and Essures in the office. The Essure is a permanent sterilization procedure. The LEEP procedure is used to treat abnormal pap smears, and the Novissure procedure is used to treat abnormal or heavy vaginal bleeding. One of the questions I frequently get asked by patients is when they should bring their adolescent daughter in to see the gynecologist, which I think is an excellent question. Many adolescents are going through a difficult time when they enter puberty and they're unsure of what is going on with the changes in their hormones and the changes in their body. It is usually recommended that adolescents or young women see a gynecologist between the ages of 13 and 15 for their first visit. This gives the patient the opportunity to meet with the physician and become comfortable. It's usually just a consultation where they get to know the physician and they have an opportunity to ask questions that they might not feel comfortable asking someone they know or discussing those subjects with their mom. A lot of times the first gynecologic visit does not include an exam, which when patients find out, of course, they're very glad to know that. It gives us an opportunity to meet with those patients and explain to them when is an appropriate time that they actually have their first gynecologic exam. The first pap smear is actually recommended within 3 years after a patient becomes sexually active or by the age of 21. Most of the time when you're seeing an adolescent between the ages of 13 and 15 and they aren't sexually active, there's no reason for them to have a gynecologic exam, and once you explain that to them, that puts them at ease. Gardasil is the only vaccination against the human papillomavirus. The human papillomavirus, which we call HPV for short, is actually a sexually transmitted disease and is transmitted by genital to genital contact. What most people don't understand is that the HPV virus is there's many different types, but we kind of categorize those types into two categories. You have low-risk HPV and high-risk HPV. The low-risk types of the human papillomavirus cause genital warts and are transmitted sexually just as the high-risk types. The high-risk types of the human papillomavirus can cause cervical cancer. The Gardasil vaccination vaccinates against the 4 main types of human papillomavirus that we're seeing. It vaccinates against the 2 most common low-risk types that cause more than 90% of cases of genital warts, and it vaccinates against the 2 most common types of high-risk HPV that cause more than 70% of cases of cervical cancer. The Gardasil vaccination is a 3-shot vaccination that's given over a 6-month period of time. It is very well tolerated, and it is recommended by the CDC. I find my job very rewarding. There's nothing better than when you've had a day that you've had a positive impact on someone's health or someone's life, whether it's from delivering a baby or you've helped them through a difficult time. It's nice to go home and know that you've helped someone. I am Dr. Neely Dean, and I am PAPP Clinic. Hi, I'm Dr. Dean. It's nice to meet you.